ADHD, Attention Deficit Hyperactivity Disorder. Now, what is it? ADHD is a neurologically based developmental condition that makes it hard for many children to sit still and concentrate. Is it common? Yes, it is actually one of the most common childhood conditions involving the brain. So there are two types of behavioural difficulties: inattentiveness as well as hyperactivity and impulsiveness. Now you can have one half of these, or you can have a combination of all of these to qualify for a diagnosis. So inattentiveness, this is when you make careless mistakes, for example in schoolwork, or you daydream and have a short attention span and you're very easily distracted. Could be that you're very forgetful, you get bored easily, and generally being unable to listen and a real struggle to get started. So hyperactivity and impulsiveness, this is being unable to sit still and difficulty to concentrate. Maybe you're excessively talking, constantly moving around and fidgeting, and then interrupting and being quite impatient, and at times overreacting and blurting out inappropriate things. Maybe acting without thinking and have trouble waiting for your turn. So there are factors with ADHD in the genes. Evidence does show us, it suggests that it runs in families. And currently boys are more likely to be diagnosed than girls. Evidence. There is no evidence that sugar or food additives cause ADHD. Certain areas of the brain develop at a slower pace or are less active. However, would always recommend a balanced diet. So social skills, this can be hard to follow and have difficulty with emotions and saying the right thing. It can be tricky to interact, and this can mean it can be tough making and keeping friends. And sometimes little things can get blown out of proportion. So tips for ADHD, we need to set clear boundaries with consequences, and we can talk through issues when things are calm. And as parents, we need to listen to our child's opinions and concerns. Mustn't forget to praise the positives and keep requests and instructions simple. And don't be worried about asking for help. There are linked conditions: autism, epilepsy, Tourette syndrome, bipolar, depression, anxiety and personality disorders, and OCD, obsessive compulsive disorder. So when managing, again, we need to keep instructions short and simple. Do things one at a time and get organised. Use apps, use lists, use reminders, use blue tack or fiddle toys, and get plenty of good quality sleep, and make happy brain chemicals by exercising. So ADHDers have superpowers. So the positives here: they have lots of energy, they're spontaneous, they can be creative thinkers, be very hyper focused and react quickly. They seem to notice other things that people miss. Now, ADHD does not stop your choice of career.